We'll go ahead and get started. Thank you guys for coming this evening. I want to teach you how to master C notes this evening, and we're going to primarily be on a simulator tonight, but I just want to share with you a couple of things. First of all, you can get a CE credit tonight if you email me your AGD number and email it to john@centricnotes.com. We'll give you 1 CE credit for spending an hour with us tonight. So let's go ahead and make the world a better place in dentistry. We're going to take our cognitive note generation methods to a new level. I'll show you how to do that with some interesting things. So let's turn our thoughts into ease, into EDR with ease. Now, I believe that the ultimate goal of dental technology, as I've said before, is to reduce the complexity of daily activities. So tonight what we're going to do is look at 2 difficult things that may be kind of a stumbling block when it comes to writing a C note. The first one is we're going to cover an example or several examples of notes that cross departments. And because sometimes you may not know where to begin, in my opinion, one of the best places to realize where to go is when you start writing your C note. It starts with your chief complaint or reason for visit. And the second thing that may be difficult that we're going to cover tonight are notes that are really where a patient presents with an undiagnosed condition. Could be an emergency, could be, I have a tooth problem that I don't quite know what's happening, maybe a TMJ problem issue or something. And so these 2 things, they're kind of cross-related, but they are interrelated. But we're going to cover the notes that cross departments first. And one of the best ways that I can share with you, let me get to our simulator, and we'll go ahead and let's see, just a moment. Let's screen share our simulator, and there we go. All right, so you should be able to see that now. Enter in 3 pieces of information. We'll just start out with Bob tonight, my initials, and reason for visit. Let's do something interesting that would cross departments, such as, oral surgery always comes to mind, because today when you're doing a lot of oral surgery type procedures, you could be doing an extraction, you could be doing a bone graft, you could be doing a soft tissue graft, and you could be placing an implant all in the same procedure. So how do you write about these things? So let's start out with our patient, and let's type in, let's say we're going to extract. Sorry, my typing's bad. I'm a hunting pecker. Extract, let's say 9 and 10. We're going to place a bone graft, and we're going to place implants. Implant placement. So let's go ahead. That's plenty to start with. Let's hit done. And you'll see, once again, you guys are good at this already. So let's go all the way over to oral surgery. And let's click on tooth removal. We'll hit tooth 9 and 10. And we don't have to hit done at this time. What I'm going to do, where it says down at the bottom, additional treatment selections. Let's do some additional treatments. So the best thing to think about when you're writing across multiple departments is you want to select what treatments. Think about first what treatments you're going to do. We're going to do extractions. We're going to do bone grafting. Well, bone grafting is in oral surgery. It's also an implant. It's in perio. So let's just select bone grafting here. 9 and 10. And are we finished here? Yeah, we're going to hit done. And next we're going to go to the implant department. And we're not going to do an assessment because we've already, say, done that in a previous note. But we're going to go straight to implant placement. 9 and 10, and hit done. So here we go. And so first of all, let's go to tooth removal. Now, you're going to have a decision where you will see, I'm going to highlight tooth removal right now, Let's get out of tooth removal and go into implant placement. Okay, and let's go into bone grafting placement. Okay, what we see here is they all have pre-op departments. Now these pre-op departments are all very, very similar, and that's why I wanted to show you that. So let's go back to tooth removal and the pre-op department. So once you're in one pre-op department, you don't have to go to another. But if you were, say, in a pre-op department for pedo, of course, it's going to look different than a pre-op department for implant placement, etc. So, but suffice to say, these three are all very similar, and we can accomplish what we want to do. So let's press on pre-op first, and you'll see the conditions. If you want to mark conditions, let's say these two teeth were fractured. So let's go to conditions, and you'll see the conditions menu will pop, and we can go to not so much failed restorative conditions, but let's go to tooth-related trauma. I'm going to hit fracture, and we're going to hit 9 and 10. Now notice it says tooth 9, so let's hit commit. We don't have to put surfaces. I mean, if you wanted to, we could say MIFDL if we wanted to, and just hit commit. And now it's asking you again for another commit of tooth 10. So let's say we'll do facial, lingual, and hit commit. So it's telling you, it asks you in detail what to regards to tooth structure. So let's hit done. So we're done here. And if you want to go through vitals, you can. You always want to review med history. The most important thing is you want no deltas or no changes. So we're going to do that. We'll hit no deltas. It's going to ask you to confirm, and then we'll close that screen out. Let's go to pre-med. Let's say the patient's pre-medded with antibiotics, clindamycin, and let's also do an oral sedation of Ativan. And you can also relate that the patient did not take medication if you prescribe something and they didn't take it. Let's close this out. Pre-op records. Let's say we took, for this particular appointment, we may have taken some diagnostic photos. So we'll hit that and close out. Now, let me go back to the pre-op records. Notice this screen here. This screen is called the Modal View. It's a screen in which you have the background is grayed out. It occupies the center of the screen. And this Modal View is generally used to create simple sentences. So you'll find that there is hardly ever a save button here. So I just wanted to let you know. So you don't have to worry about saving when it comes to a simple screen as a modal view. So let's go to pre-surgical management. You'll notice that a lot of these screens are modal type views. So pre-surgical management for an implant or extraction, bone grafting, all very similar. We're going to implement plaque control techniques, atraumatic brushing techniques. We addressed any anatomic concerns, any systemic concerns, chlorhexidine rinse. We're going to use a surgical template, make sure we have it. Frenectomy, we'll skip. Deficient restoration, since these are coming out, we're not going to worry about that. And we prescribed antibiotics and analgesics preoperatively, so they already have that. Hopefully, in this kind of situation, you would have already, you're just confirming that you gave it to them, not the script itself. Let's go to anesthesia. So when you give some anesthesia, we'll do topical benzocaine. We'll save it. We're going to do local infiltration, and let's do lidocaine, say a half a carpule, and save. And then we'll do local infiltration, septicaine, say 1.5 carpules. Let's make it 1 3/4. And you can see how easy it is to write this note. Supplemental information, information on treatment. We don't need to go into preliminary impressions. We already have all that, we presume. So let's go ahead and close this out. And now let's go to atraumatic extraction. So notice how we are reading right to left and top to bottom, just like a book. The idea is we were following our path of how we treated the patient. So we started out with tooth removal. So what you do is you basically take the your treatments that you are going to implement, place them on the top, and then go through each one systematically. And learning your pathways, for example, when we get into implant placement and bone grafting, you won't have to go to pre-op at all. You just skip it. So let's go to atraumatic extraction, and we're going to click on that. Now this view here, anytime you see a view where you're working in the lower half of your screen, this is a treatment view. Now a treatment view is generally used to write more complex notes. For example, first of all, anytime you see this little icon, this little molar icon, that's the note, that's C-Notes asking you to please select teeth. This blue banner, it says close, teeth, save, or start over. We're going to hit teeth, okay? And we affectionately call this the grill. So we're going to pop the grill, as we always say in C-Notes. And then we'll select 9 and 10. Teeth, selecting teeth removal, hit the checkbox, and then hit save. Now this particular screen, it's saved, you want to save often. The atraumatic removal for tooth 9 and 10. Now, mucoperiosteal flap raised, if we are going to do it at this time, you can easily do that, but we're going to delay that. So we're just going to take these out without putting a scalpel or not raising a flap. So next thing we're going to do is go down to, we don't have to section a tooth. We're going to sever the periodontal attachment. We're going to detach the ligament, and we're going to create a purchase. We're going to elevate, and then we will take some forceps and take it out. So if you want to press debridement here, you can. I'm going to show you another place to do it. Notice how we went through all these check marks, and now we're going to hit save. My rule of thumb is in the treatment view, you want to save often. So it's going to write what you see here when you press save. Now, we finished atraumatic extraction. We didn't lay a flap, so we have no closure to do at this point, and there were no complications to report. If we wanted to, I'm going to press complications. You can see such things as bony fracture, fracture of adjacent tooth, luxated adjacent tooth, etc. So let's say there are no complications, extractions, so let's close that out. And so you notice you see traditional extraction, impaction removal, etc. We can go to finish, whether hemostasis was achieved, whether the patient was escorted, post-op phone call, etc. But we're not going to do any of that because we have more treatment to write about. So I just wanted to show you where that was. So let's go to bone grafting. We're going to place a bone graft here. Now, we can skip pre-op. I'm going to show it to you anyway. You see it's identical. So we'll go ahead and close that out. Patient consultation, informed consents we already have on this particular procedure. Let's go to the type of bone grafting we're going to do is going to be a socket preservation for both of them. So we're going to press socket preservation. Notice another treatment view comes up, socket grafting preparation. So we're going to press that first. Let's look at the root lengths. It says, first of all, you see the molar icon, so that's going to tell me to pop the grill. I'm going to press 9, root length, and you can record how long the root length is. Let's say it was 12 millimeters. And we're going to hit, let's go continue for this particular tooth. Let's say we had a 2-wall defect. And let's hit save. Oh, and you can also go down here and you'll see socket debridement again. So we'll hit that, hit save. And let's go to 10. We'll hit 10. I'm going to go back up here, hit root length. We will, let's say it's 10 millimeters for the lateral. We'll hit save. So you can see, and we'll do a 3-wall defect and socket debridement. And let's hit save. There you go. Okay, now we're going to next. Now we want to, let's raise a flap. So we can place, let's say it's an envelope flap. Incision, we'll hit save. Incision will be, let's say, palatal crestal, and we can do parasulcular. And we'll hit save. The dissection will be full thickness. Save. We're not going to place the membrane. We'll just close this back up. Our bone graft materials. So let's discuss that. We like to use an allograft. And we're going to do FDBA. Notice how this is a modal view. It pops this, it writes the note immediately. Let's discuss reconstituting it. We're going to place sterile saline to reconstitute it. If you want to use a PRP, you can place that. Graft material. Let's go ahead and say that the graft material was placed. No membrane placed over it and no fixation. So let's go ahead and close this out. Let's go to, are we going to flap replace? Not quite yet, because we still have to place the implants themselves. So if we did, you would see it would look like this, tension-free, etc. We'll get to this same screen in just a moment, but in implant. So we're not going to do soft tissue flap closure. Any surgery complications, you'll see change a little bit with here. I want to make sure we have complications that you can have. Let's close this out. No complications. We're trying to keep things simple tonight. Now let's place some implants. If you wanted to go to finish, you can see what finish looks like. Hemostasis achieved. Once again, same finish as before. Let's go to implant placement, and we can skip pre-op. So you see, this is how you learn your pathways. We can go to implant selection, and let's go to the implant guide. We're going to select 9, and let's say we used a Zimmer. Implant type, say TSV. Platform, 4.3. Length, let's say 10 millimeters. Lot number, we're just going to put anything in. And you always want to put the expiration date on these things. Very important. It's becoming a necessity. The federal government's going to be requiring this. And a reference number, and let's save it. Let's close this out. So it writes the note, and what it did just now is it's also creating, let's go to tooth number 10. And let's do the same thing. Zimmer. Same implant type, but this allows you to put different implant types for different teeth if you were going to do that. Let's change the diameter. Let's put, I don't know, I think it's 3.7 for Zimmer, or 3.8 maybe. I don't remember. Let's call it a 10 millimeter implant also. Lot number. To the expiration date. And reference number. That way, when they get recalled, you can always know where they are. All right, so let's, now what I want to do is we're going to, let me just finish this surgical guide. Let's say we use a CAD/CAM guide, and let's call it completely limiting to play it safe, and we're going to hit save. Now what I'm going to do right now is I'm going to go back to that, but what I want you to see here is this, what we just created. I'm going to hit conclusion and then go to review note immediately. You see down here at the bottom, you have all the information that you just asked for. 10, move this to the center of the carousel. So that's the beauty of having a PDF document as opposed to a rich text format. You can, it's interactive. You can find these things very easy. So I'm going to close this out. We're going to close out the conclusion panel. Let's go back to flat design. And we already described our flat design. Let's go to incisions. And we already described that. Let's go to dissection. We described that. GBR we described. So you see all these things are done. Bone graft materials, we already described that because we already placed it. But it gives you the opportunity to do it in both places. So let's place the implant. So it's just a matter of learning what is in the C note itself, in the application, and learning. Many times things are in multiple places, and we did that because we want to simplify the way you're thinking. Oh, I don't want you to think, oh, do I have to go somewhere to find something? If you start with a treatment department, you should be able, treatment departments like we did, you should be able to complete it many different ways. So there is no one way to skin the cat here, so to speak. So let's go to the surgical guide. Well, once again, when we get in a treatment view, you can see how we read top to bottom, and you complete the panel. So surgical guide was placed. We're going to hit save. What kind of driver do we use? Let's use a surgical driver. Save. Of our implants, let's make them level with the bone. Final tightening, let's make it 45. And let's confirm with X-ray confirmation that everything has been good and it looks good. Sleeper implants if you want. So now that we've finished here, we can close this out and let's go to finish. We're going to finish. We can describe what kind of implants that we wanted to place. And let's do immediate load. And let's say we're going to put on a temporary abutment with a functional, with an aesthetic non-functional prosthesis. So we're going to connect them and let's make sure that they're not in occlusion, and we'll hit close. So now we can go to flap replacement now that we're finished. So let's do replacement position. We want a tension-free verification. We're going to smooth the incision edges, deepithelialize the host papilla. We're going to coronally reposition. If you want, you can add Decatron. And soft tissue closure. Here we can type in a suture number. Let's say we put in 5. Suture type. Let's type in, say, Vicryl. Lot number, once again, same thing. Put in a lot number. Now this information, even though it looks like it may get stored in the carousel, this particular information just gets stored in the notes. So we'll put expiration date. And let's hit save. So it writes everything right there. You can see the toast that popped, the little black thing, little black sentences are called toasts. So we can close this out. Applications we can review, unable to place implants, and you can ask for the reason. Osteotomy complications, excessive bleeding. It could be, anything like blood pressure, etc. Notified of complications. It's very important to discern or notify them and record it. Surgery success prognosis. You can always put that in there, and we're going to put, you can put good if you wanted to, if there was a complication. So let's close out. And now let's go to conclusion. Now that we've been through all these, all 3 of our treatment procedures, let's go to conclusion, and we'll go to post-appointment instructions. We can go straight to oral surgery. Where are we? There we go. Oral surgery. Let's do verbal and written for bone grafting and extractions and implant placement. And let's close that out. Any meds that we prescribe, we already prescribe, but if you wanted to, you can prescribe, for example, antibiotics. You have all kinds of antibiotics here. You have all kinds of antimicrobials and narcotics. So we'll close that out. It allows you to record the prescription. You don't actually write the prescription here. You just record it. We're going to skip referrals. Next appointment, let's go to, here are the departments here. We're going to go to oral surgery. And we'll put 9 and 10. And we're just going to say bone grafting. Let's do follow-up 1 week. Good. There you go. So let's close this out. Close out that screen when you're finished. Let's review our note and see what we have. And you can see we have extract 9-10 bone graft implant placement, tooth removal 9-10, atraumatic extraction, bone grafting 9-10, socket preservation placement 9-10, and I showed you surgery complications, but we didn't record any. Anyway, so if you wanted to edit this right here, the way you would do it is to press the edit button, and you can go ahead and you can see how we can actually, there we go. We can actually just take surgery complications out. Tooth removal, pre-op. So we talk about our pre-op. Patient presented with the following preoperative conditions. Number 9, fracture MFIDL. Number 10, fractured FL. A review of the patient's medical history revealed no changes since the patient's last appointment. The patient was medicated with clindamycin 600 milligrams. The patient was administered Ativan 2 milligrams orally. Diagnostic photos were taken. Pre-surgical management steps were taken to ready the patient for surgery, which included implementing plaque control techniques, patient education regarding atraumatic brushing technique, addressing anatomic concerns that may affect surgical outcome, addressing systemic concerns that may affect the surgical outcome, prescribing a chlorhexidine mouth rinse, creating a surgical template, prescribing antibiotics, and it goes on and on. You can see how detailed this is. And now, atraumatic extraction says atraumatic removal of teeth 9 and 10. Periodontal attachment was severed, ligament was detached, and it goes on. The socket was debrided of cystic material. And let's see, socket preservation. We talked about that, how we use FDBA freeze-dried bone and PRP. And also, you can see the selected Zimmer implant for tooth number 9 is a TSV 4.3, 10 millimeter. It's also in our carousel at the bottom, which you can pop up. Now, if you print these documents, if you print this note, what you're going to find is that the two pieces of information, documents in the carousel, they will print on a separate sheet, so it's easy to keep. So it's quite big and easy to see. So we'll close that out again. Let me go back to review note, sorry. And let's see what else we have in here. So implant selection, implant insertion. In fact, we used a surgical guide. The final location, was level with the buccal bone. It was torqued to. An X-ray was taken to confirm the location and direction. Let's see. And the fact that the implant was directly loaded with an aesthetic non-functional prosthesis. Now, if you want to get into more detail about the aesthetic non-functional prosthesis, what I'm going to do is close this out. Now, one thing, let's see, post-appointment instructions. So, yeah, let's go back to here because I want to show you something. See where it says, let's see, well, I already did it for you. So I'm going to take this away, surgery complications that we just did. Notice how it popped back on the screen. I'm going to explain it to you in just a moment. So let's take that out, and I'm going to close this out, and we're going to go back and write a little bit more. Now, what we're going to write is let's write some detail about, excuse me, there we go, about the prosthodontic temporary. So we go in the prosthodontic department. I'm going to go to implant prosthetics. We're going to do splinted implant crowns. I'm going to press 9 and 10. We're going to hit done. So let's go to splinted crowns. Bypass pre-op, bypass patient consultation. We're going to go to, if we wanted to, we go straight to provisional. And we're going to put provisional implant stage, and we're going to say it is a non-functional immediate. Save. Let's go into provisional design. Let's say we used and let's use a plastic abutment. That's what I was trying to determine. We hit save, and we will use a titanium screw. And let's go ahead and hit materials. And let's say we used a composite resin temporary, or if you want to do ProTemp or Luxatemp, pre-existing restoration. But let's do something simple like Luxatemp. We'll save that. You can record the shade. Here you can present the shade guide, do a basic, let's just say A2, done. Refined, we adjusted the occlusion, refined margins, shape, surface glaze, etc. Our method, let's say, is an indirect matrix. And we cemented, let's say with temp bond or temp grip, anything like that. Did we take let's say we took a photo of it, provisional record. So you can see we just wrote a lot of detail about a provisional splinted temporary bridge. So let's go back to conclusion. Let's review the note. I'm going to write as we go down here. Notice how it writes in order. So splinted implant crowns, a non-functional immediate temporary was placed, and it goes on and talks about the detail. So you can see how we just cross departments. But what I want to go back to, so this is a wonderful note. Now, if you learn your pathways, how long will it take you to write this note? You know, you can actually get it done very quickly. I would think a note of this magnitude would take about 3 minutes to write if I were to write it just sitting at my desk in between appointments. Now, normally, complicated notes like this, I will write non-complicated notes like a filling, something routine with no complications, no surgery involved. My staff is trained to write. Root canals, things like that, I generally write to make sure everything is covered, because those are really the notes that can get you in trouble more than anything. You know, doctors will get sued by people for implant placement, for oral surgery, for root canal, advanced root canal therapy like molars and things like that. So, I generally will write the notes for that. So let's go now. Notice here that it says it adds whatever we touched in the order that was created. So splinted implant crowns was last. So let's go. Notice surgery complications is back here. Now what happens is, why did it reappear when I've already eliminated it? Well, when you're in this note, this right here, I'm going to put, I don't need that. When I put this, when I look at this review note in the conclusion page and I make any edits, if I were to close this out and go back into the app, which notice what I just said, I went back into the app. When you are writing, when you're editing this page, you're actually outside of the C-Notes app. You're into the general workings of the iPad itself. So we don't have a way just yet. We're working on it, and we've thought about it long and hard. It's going to take a little bit of doing to be able to save anything that you edit and bring it. And then if you were to go back into the app and then come back and have it saved there, we'll have to create a placement for it, like a placeholder for it. So once we have this, we have the opportunity to send. You can normally You have to create an owner password for the PDF encryption and a user password PDF for the encryption. It's very important that that is done. It's a requirement. You don't want HIPAA to get on you for such a thing. So once we're capable, when you're in this mode, you really can't send an email. I'm on the simulator. If I were on my iPad, I would be able to send it immediately. So again, that's what the share button's for right here in the upper right-hand corner. So you can see how we wrote a very complicated note. And believe me, once you learn your pathways, once you learn that most pre-ops are identical, the consultation, appointment, and things like that, you're going to skip. I mean, consultations you're not going to do at the time of surgery. They will have been done at a previous appointment. So things like that you'll learn. Bone grafting is found, and let me close this out. Bone grafting is found in 3 different places. It can be found in oral surgery, it's found in implant, it's found in perio also. So for the periodontist, if you want to use perio to do bone grafting and soft tissue grafting, it's going to be identical to oral surgery. Oral surgeons, if you want to do that, you can place it, you can do it either where you want. So let's go on. I'm going to clear my data. The app saves nothing. We clear all progress. I'm going to go ahead and start again. So let's get Bob. We'll do user initials again, JS, and let's do something like examinations. A patient comes in and let's say, for example, they have, now anything can happen, but let's say, for example, a patient comes in with pain, lower, we'll say to chewing. We'll hit done. And now we are back in the app with a different Bob. And so the first place to do in this situation, like I said, we're going to cover, we have an undiagnosed patient. We don't exactly know where to go. Do we go to endo? Do we go to, operative? Do we go to pros? What does this patient need? Well, let's go to examinations. Anytime you have question marks and something is undiagnosed, you want to go to examinations. So we're going to open up examinations. It's just a treatment selection is just very general right here. And if you wanted to select teeth, because it's the lower left side, let's say 18, 19, 20, 21. And let's hit done. So we're going to do exams. So now we open up examination, and you can see we have pre-op. Of course, you want to cover your pre-op conditions and things to begin with. So notice this pre-op, instead of opening up a panel, it opens up a more detailed look in the treatment view. So let's say we go ahead by start taking some intraoral photographs. Save. Let's say we took mandibular and maxillary impressions, alginates, and save. We take x-rays. Now, if you want to, we need to change this. We have extraoral, we have CT scans, and we have FMX under extraoral. It really should be an intraoral header, but we haven't placed that yet. Just want to let you know that that's there. But let's just go to periapical x-ray, because that's what most doctors are going to do in this type of situation. Notice we have the molar icon again. So what are we going to do before we press periapical x-ray? We're going to press teeth. So we're going to take 18, 19, 20, 21, and we're going to press periapical x-ray, and let's hit save. So you can see it tells you that what we just did. If we recorded vitals, you can do that. I'm going to skip that for a quick, well, let's just do it anyway. Let's go to vitals. Blood pressure, 120/80. And heart rate, let's say is, I don't know, 75. He's a little nervous. So let's commit vitals. And so now we're going to go to review med history. And let's say their existing patient, no changes. If you wanted to mark changes, let's say let's say it was diagnosed with high blood pressure, even though his blood pressure looks good, and you can just put a generality. Let's say it was in 2015, about a year ago. So just hit off the screen there, and it'll record that. And so let's close. If you wanted to do current meds, you can review current meds. And let's say he is on, we go to circulatory at the bottom. And let's say they put him on Lipitor. And I don't know. So we'll hit save. So let's go back and close out this modal view. And do we have to pre-med? Let's just say no. Close this out. Now that you've finished this panel, let's go to, now, new patient. What is new patient? You know, I don't discuss this too often. We're in a process of, we have a build coming out. We keep our fingers crossed this week. A new build has a little more detail in it from a materials perspective. But in the next build, which will probably be in about 3 weeks, we're going to take this new patient button, and it really should be called either a new patient diagnosis, or new patient findings, or new patient review, because really what it is, it describes your diagnosis. So we're going to actually put this at the end of this examination field here. So past implants, that's where we'll put that. But I'll tell you what, we're going to get to new patient in just a moment if we consider this patient a new patient, not existing one. But let's go ahead and say, okay, periodontal wise, we have some pain. And so let's look for bleeding. We can do a periodontal examination. And let's say in the area we want to, I'm going to scroll down, and let's say in the area we can do quad. Let's say quad 3. And we'll say it's light to moderate. So we have a little bleeding in the area. What about pocketing? We can be very specific with pocketing if we want. We can record, whether it's generalized, anterior, posterior, quad 1 through 4. We can also put here whether you did a full probing, whether you did partial, no pocket changes since the last appointment, within normal limits, or pocket changes noted in the perio chart, which many people, if they use perio charts in their PM software, you can record it there. And this is just telling you in your note that that's where it can be found. But let's go, for example, we see the molar icon again. Let's press the grill. And let's say, I'll show you how I would record something interesting. Let's go 18, 20, 21. And this is what we found, that distal buccal, distal lingual, we found 3 millimeter pockets. So we're going to hit save. And we're going to put same thing, 18, 20, 21. We're going to say mesiobuccal, mesiolingual. We're going to say 3 millimeter pockets. And we're going to hit save. But the culprit here, 19, we will say distal buccal, distal lingual has a 5 millimeter pocket. And hit save. And we can say 19. I'm sorry, not lingual, but mesiobuccal, mesiolingual, we'll say is 3. So we hit save there. And so let's go to recession. Let's say we see some recession, and once again, you can mark it, tooth number, let's say 19, buccal, and we'll hit, let's say 2 millimeters of recession there. Mobility, we can record that there are no mobility changes, or we can just say it's within normal limits. Let's do this. We'll do mobility within normal limits, save. And let's go to plaque. Let's say generalized plaque, and we'll say it's mild to light to moderate. And attached gingiva, if we wanted to, we can mark that the attached gingiva for 18, 19, 20, 21 is within normal, 21 is within normal limits, and we hit save. Let's go ahead and close this out. That's our perio examination. Dental conditions. Well, let's say we have, we can notice some things. Let's say there is an amalgam or several amalgams, and we will put, for example, amalgams. Let's mark, let's see, let's do 18, 19, 20, 21. So tooth 18 is asking you, what do you see? We have an occlusal amalgam commit. Now notice how the 18 just went normal colored, and here 19 is highlighted. It's asking for tooth 19, and let's say we have an MOD. Let's commit. Tooth 20, we'll put an occlusal in and hit commit, and now it's asking for 21, and we'll say, I don't know, buccal amalgam, something old-fashioned. And so, and let's put one more thing. We're going to put secondary decay that we've located in tooth 19, and we'll put distal, so secondary decay to that filling distal, right where the periodontal pocket is. Also, what else can we record? We can record existing dentistry. We can record failed restorative conditions, and here you can just put failing amalgam. And let's say we got a failing amalgam on 18 and 19. And you can just hit commit because you already talked about where they're located. So you don't have to record, and then we'll hit commit for 19 too. And let's get out of conditions. And where you can really find something for this patient is in endodontics. So now we went through periodontal exam, we went through dental conditions exam for this area, and let's do endodontics. So symptoms. First thing you're going to see is there pain? Well, yeah, there's pain. The patient said it was, let's say it's sharp and spontaneous. The duration, let's say, is momentary. Onset, we could say, was let's say yesterday. And location is localized. Activities provoked by chewing to cold. And heck, for fun, we'll say it's sensitive to heat also. So the intensity, let's say, is mild and moderate. So we finished that. Let's go to swelling, and you can connote the negative here. So let's say no swelling, and we will hit close. And so now we go to radiographs. Now, here's a situation where, notice we took a radiograph in pre-op. Now we get to talk about it. So what do we find? Let's say we found, once again, you see the molar icon, we're going to hit teeth because we're going to be talking about them. And you can see an endodontic grill here. So let's go, let's say on all of them, we see signs of clenching. We put a widened PDL, and we're going to hit save. Now, at any time, you can make a diagnosis here in this situation. So you can, if you wanted to, for example, we'll get to that in just a moment. Let's do cold tests. And the way we would do this is let's do 18, 20, 21. We're going to say mild sensitivity to cold, and we'll hit save. And let's do number 19. We might say that it is moderately sensitive to cold, and hit save. Let's do some heat tests. So we're going to press 18, 20, 21. Heat test was normal for those, but for 19, it was moderate to severe. So we know we got a tooth going bad. Let's go ahead and do some more tests. Let's have the patient bite down. Let's say percussion, we're not going to tap. But let's go to, one thing I forgot to show you. I'm going to go back to radiograph real quick, because one thing I didn't finish with radiograph is, if they had external resorption, bone loss, furcal loss, that kind of thing, periapical radiolucency you can mark. But let's say in this particular case, there was no periapical radiolucency. So we're going, moving down the road, but we know we have a tooth that's going bad because it's sensitive to heat. We'll go to, we're not going to percuss. Well, let's say we percussed and it was, let's say all were normal. So you can see how this is coming along. Tooth sleuth. Let's say tooth sleuth, 18, 20, 21 were normal. Hit save. And let's say 19 was moderate to severe, and hit save. So now we're ready to make a diagnosis. And let's say what we have here is on the diagnosis, if you wanted to, you could say 18, 20, 21 are within normal limits and hit save. And if you go to 19, we can say we have irreversible pulpitis and hit save. So other things you can do transillumination, perio probe, selective anesthesia, sinus tract tracing, that kind of thing. So let's click out of here. So now we know that the patient has an endodontic problem. So what do? Well, the next step normally is you're going to consult with them. So the next thing I would do is go to the endodontic area. Okay, we'll click on that, and we're going to hit root canal, and we're going to say it was tooth 19, and hit done. And so in root canal, we don't have to go to pre-op, because let's say if you wanted to start it today, you could. But the important thing here is we're going to do a patient consultation. So notice how we go on cross department. For the specific need, we're going to do a patient consultation. If you want to get an informed consent at that time, you can. So our present at the patient consultation, let's say it was the patient and a dental assistant, and including yourself. Proposed endodontics, we'll do a root canal. Patient's conditions education, we talked about deep decay, repeated dental procedures, having a secondary decay. We talk about cracks, the pulpal inflammation that occurred. The treatment purpose would be to save the tooth, remove the pain source, and improve the restorative result. So our local risk factors could be poor hygiene. Maybe have not seen them in a while. We can also have other things, could be trauma, for example, clenching. Systemic factors, let's say there are none. Treatment options, we'll go to treatment options, and we will say, well, you're going to need a root canal and a crown. We can also say your other options would be we could take the tooth out and place an implant. If the patient has no money, maybe you could do a pulpotomy and just buy him some time. And so we could also do no treatment if you wanted to. So let's go to treatment discussion. Well, we're going to talk to them about the treatment of pulpal tissue, chemical therapy like using sodium hypochlorite and calcium hydroxide, cleaning and shaping. We're not going to talk about external filling or repairs. We're going to talk about endodontic outcomes and healing times. Operative risks, well, you could get swelling, you could get bruising. These things we talk about. Postoperative pain, you could get trismus. We could develop an infection because it's kind of on its way to developing an infection. You could talk about antibiotic reactions, etc. Non-treatment risks. You could have, of course, infection if it's not treated. You could lose a tooth. You could have more pain, an aesthetic compromise, and restorative compromise. Also, maybe a psychological implication, for example, if it were a front tooth. And so next, you want to talk about whether or not it's going to require future treatment. Well, it might require more antibiotics, might require a retreatment. It might require an extraction or prosthetic treatment, or possibly even orthodontics. But so you can see what we've done here by going through this consultation. Now, when I go through a consultation with a patient, I will actually have this patient consultation form for a root canal in front of me, and I will make sure that I cover these things as I'm seeing them, and I check them off as I'm talking to the patient. It's that simple. So now, what's great about this, we close this out, and all that has been recorded in the conclusion view. So if we go to conclusion, we're going to go down to review note in a conclusion panel, and you can see periodontal, notice it says exams at the top, periodontic exam, endodontic exam. Then we're going to have root canal therapy patient consultation. So it tells you everything that we just discussed, it goes into. So let's close this out and go back. And what we're going to do is then go to the endodontics informed consent. And I go through this many times, but it's very important that we can have present at the consultation, the patient and dental assistant. And if you wanted to add, for example, the doctor, you could do that, but it's kind of implied. You can have the patient accept it. Want the patient to accept each paragraph after it has been read. Once it has been read or edited, if they decline it, well, then you have to decline treatment. It's that simple. But it tells you where they stand. And once they finish doing all that, and accepting every one. Then we can go ahead to the patient signature and write in patient signature and save it. So this is all done. The data is created automatically. So you can hit save and we'll close out. If we go to conclusion, you won't see this. You'll see the signature carousel, but you won't see the consent form. But what you do in this instance, it's in the note. When you send it, it will be there. It's there for printing. You can print it, give a copy to a copy, it gets retained in the notes. But you can also, when you print, you'll print a copy of it at that time. And you can give that to the patient as a record. So you can see how easy this is. That once again, we crossed departments. We had an undiagnosed situation where you can see how things, where you're not quite sure where to go. Whenever there's an undiagnosed situation or a condition where you're don't quite know where to begin with, if it's undiagnosed, you start an examination. If it is diagnosed but you don't quite know what to start, just write in the reason for visit, and that will tell you where to go. If you did bone grafting extraction, then you go to oral surgery and bone graft and extract. If you did, soft tissue grafting included in that, you can do that. And if you placed a temporary, and if you prepped a crown, you just go to, you go to prosthodontics, you select crown. If you did an implant at the same time as you prepped a crown, you go there also. You just cross departments and write the note as you want, and it will appear as you see here in the order that you wrote it. So we are done for this evening. I want to thank you guys for sharing an hour with me, and send me your CE credits, your AGD number, and we will deliver that to AGD and get your credit confirmed.